Maybe we all saw this coming, but it's still not great news to hear the governor's indoor mask mandate has, quote, at least another month to go. That as the Delta variant continues its march through New Mexico and the nation. Over the past few days, we've seen case counts level off a little, but they're still high, as are hospitalizations. Now, one new thing is the Biden administration's request to have OSHA force businesses with more than 100 employees to require vaccinations, as you might have heard. And Dan McKay, does it feel to you as though anything has changed with respect to who is going to be abiding by these mandates, masks or vaccine? Is the same people abiding, the same people not abiding? Have we brought this closer together? How's this going to work?
It does. There is some evidence that vaccination rates have picked up a little bit. At least they did in August.
Due to the mandates?
Yes. So I think, and incentives, there was $100 incentive. So I think that, there are people out there who are genuinely reluctant to get vaccinated, but still open-minded. Mm-hmm. And those are the people who are going to come up with employment, who are going to comply when their job is on the line. Mm-hmm. So I do think that, the opposition is not entirely hardened, although there certainly is sort of a vocal element. But there are people who are still getting vaccinated, for the first time this far into the pandemic.
Mm-hmm. Senator, interesting stats here. Unvaccinated people are 40 times more likely to die of COVID. 9 out of 10 COVID hospitalizations are unvaccinated people. A lot of folks know this, but a lot don't. And a recent study shows an almost $8 billion cost to treat unvaccinated COVID infections. That's a phenomenal number when you really think about it, $6 billion, not to mention the loss to the economy. I guess I say again, is there, for folks that don't want to abide, should there be a societal cost to them? Should society make it a little more difficult on them to go anywhere, to do anything? Is that the next step here?
Well, it's hard to see what the next step is. This seems pretty drastic as it is. But I do think, yes, that we'll see if this works. I think, a $14,000 fine for a business who does not require vaccinations to protect its own employees,
right,
or testing is pretty hefty. But there needs to be, this is a pandemic of the unvaccinated, mm-hmm. and we are all paying the price for them. In fact, I read a story just recently about a nurse who worked in a ICU who is quitting because she has worked day in and day out with people who have had COVID at great physical and mental cost to her. And now she's working with people who had the choice of whether to get vaccinated or not, and they chose not to. Mm-hmm. And now she's saddled with taking care of them, with putting them on a ventilator, with conveying their last wishes to their families. Mm. And, it's too much to expect of people. It's too much to expect. And I think that the president will be on very firm constitutional grounds with requiring vaccinations. And I think that will make a difference. It's going to take a while, but people are getting vaccinated because I don't think people are ready to go back to being shut down. And that is that if we don't get a higher vaccination level, that may be the only alternative. And no one wants that. That damages the economy tremendously.
There you go. A good point there, that last point. Hey, Crystal, the White House is selling this mandate as a cover for businesses who want their employees to get vaccinated but are worried about requiring it themselves. In other words, they can now blame the government. I mean, you own a business. What are you asking or requiring? And if you had over 100 employees, I got to ask you, would this feel better to you?
Well, I wish I had over 100 employees, but it's very awkward for a small business owner or a large business owner, because technically, under 100 is still a small business in the U.S. In the Small Business Administration's eyes. It's so awkward to have these conversations and in terms of leadership, because some of us business owners actually want to make sure that an individual feels comfortable in the workplace, but because of external circumstances that are outside of the workplace, it makes it uncomfortable to have conversations about vaccines. Knock on wood, we haven't had an outbreak here in our office at Ciarza, but it's still very nerve-wracking to have, and it also becomes a matter of how do we make sure that, on one hand, we're asking very politely and some individuals are not getting vaccinated. On the other hand, we've got some of our employees that feel uncomfortable if our other individuals, and if we can't talk about it as an organization. Mm-hmm. And I think one of the things I do kind of want to divert away from the conversation about small businesses and look at like what at the whole picture of our country. I feel very optimistic, not only from the state of New Mexico, but here in the United States, that we're actually finally hitting a plateau. And I understand that small business owners and employers in general have to make sure that the doors are still open, because the amount of sick leave and the amount of outages that we've had because of people coming down with COVID. I feel very optimistic that we're actually hitting the plateau that we're starting to see here in New Mexico, that employers are just anxious to go back to what life was like 2 years ago. And 2 years ago, when nothing was going on in terms of COVID, right. And all of our employment and our staffing levels were pretty okay. But
let me jump in for Dan here for a quick sec. I appreciate that. I want to take a brief moment, Dan, to chat about ivermectin. Are we over this? If studies show ivermectin is effective, what's the hit to trust of the medical community? Is that fair? After all, this is how science works, right? I mean, there's almost like a mini trial going on that people are taking upon themselves to do. How should we consider this ivermectin thing?
Well, I think it's just too early to say whether ivermectin is effective for COVID-19, according to the FDA and the CDC. There are studies underway. It may prove to be an effective treatment, but that's not clear yet. We've had our first suspected ivermectin overdose death in New Mexico, but that is not connected to, a prescription from a doctor. This is someone who apparently got the medicine from a veterinary supply store, and that is a whole other thing, in terms of the volume or self-administering something like that. So there are kind of two separate issues. There's sort of this black market type of vet supply drug, and then there's also people who get it through their physician. But the state of New Mexico, the top physicians for the health department are advising people, do not try to take ivermectin on your own. Let the studies play out, and we'll find out if it's an effective treatment. There are other effective treatments that are already available. Mm-hmm.
Good point there. Senator, let's talk schools. How do we feel it's going to work? With in-person learning, it's clearly important and better for most kids to learn that way. We all know that. But August saw a huge increase in positive cases for kids who were on campus at some point. Now, that's starting to wane, certainly, but does anyone see any way around this other than masks and vaccines, Senator? I can't imagine there's any other solutions out there.
I agree with you. I think that we have to maintain masks, and of course that's what the state order said, indoor masking for the next month, and particularly important in younger children for whom there is no vaccine yet. And I wish I would hear more talk about vaccines for those younger children. You don't hear that much about it.
I was just about to ask. Let me spin that to Crystal. We won't know until the end of the month, actually, if the CDC is going to recommend vaccine boosters at 6, 8, or 10 months. Any sense we'll get a similar, rate of people to get with the shot? We're not talking about kids here, as Dee Dee just was, but the booster thing, does that have a chance in this society?
So the booster thing, I think, does have a chance into our current society now, especially for those that are immunocompromised, like Councilor Lancena publicly came out and said, me as a cancer survivor, I'm currently actively going through chemotherapy. It was the best thing. As much as I wanted to make sure somebody else had the vaccine, I need to get a booster myself. So yes, I think that booster shots should absolutely be a part of the conversation. Talking about children, if there was any big critique that I had, it is, why are we not talking about children? Agreeing with Senator Dee Dee Feldman, like, we absolutely need to start thinking about vaccinating our children because of the fact that, looking at, polio and how that was a children's type of illness. We look at mumps, rubella, measles, et cetera. We have vaccines for that. Why not add that? Why not add COVID into the conversation, so that way over time our communities become immune to COVID over the next generations.
Good point.
And I think too, yeah.
Go ahead. Last word. Go ahead. Real quick.
And the last thing too, it's like we just need, the world in general just needs to get on board with vaccines. I look at things that are happening in China and losing trust in vaccinations and the lack of education in China, in the Philippines, in Asia, et cetera. It is really disheartening to see that the rest of the world doesn't understand the importance of vaccines and helping us get back to where we need to be as a global economy and as a community of various different countries. So
That'll do it for this week. Thanks to our panelists. I'm back in a moment with some final thoughts.